able to hear you. All right. Let's get started. Thank you for your patience with us today. I actually shared with Matt over the weekend that I am very much enjoying this case study series because it feels really good to look back at clients over the last year and just to see what people are capable of doing, what the human body is capable of doing when given really good information and the right stimulus. I don't know, it just feels good to be thinking about what has happened and what we've seen people accomplish with good information in a short period of time. So I hope you all are enjoying it as much as we are. Today, we have a very special case study for you. It actually happens to be a client that, well, we used to be a client of hers. Then she became a client of ours. And then after the story that you hear, she actually went through the mentorship program herself. Just the results were very powerful. So this one's a really fun one. This is a woman who's an athlete, and well, she may or may not call herself an athlete, but she's a dancer and she has danced all of her life. And this is a story of an injury that she went through and the recovery and rehabilitation process that she went through. So hang in there. Here we go. I will mute my computer and I will let Matt take over.
All right, welcome everybody. Glad you're here. Those of you watching the replay, hello, we love you. I'm going to just jump right into this one because this is a longer study and I don't want us to miss out on any time. So let me share my screen here and get this dialed in. All right. Whoop. How about like that? All right. So from pain to performance, this is all about injury rehab today. So physios and therapists, we're talking your language, healing from surgery and some broken bones. So let me go. Let's meet Jessica. Jessica's our dancer and certified holistic nutritionist. She's pretty awesome. Hi, Jessica. So a little bit of history on why she came to us. In this particular case, she fell while she was dancing and broke her right radius and pisiform bone while doing a spin turn, not the jump that you see here, but a spin turn. November 26th was the injury, right? She's turning rearward to her left, got tangled up in her high-heeled boots, and then kind of went over and landed back on that right wrist back behind her. And so that's what caused the break. They hard casted her for a week, and we're hoping that the bones were going to start to set on their own. But after going in for that 1 week checkup and taking a look at another x-ray, the doctor said, nope, not going to happen by themselves. We're going to have to do a surgical repair. So surgery is performed first week of December 2021. All right. The dates are important here. So as we go through, you're going to see multiple dates, very significant in this case study. So the surgical repair performed first week of December looks a little something like this. They put a titanium plate and 9 screws in. So you can see in the original x-ray that radius is just kind of shattered at the end there. So that's why so many screws. It's harder to detect the pisiform on this particular x-ray, but you can see that one really well. And that's kind of a lot of hardware that they had to put in there. Now, in her very first, well, let me talk about her history. Sorry, I forgot about this. So she got ongoing vestibular issues, motion sickness, dizziness, has been diagnosed with Crohn's disease. So lots of digestive issues and GI stuff going on. History of multiple flares. Some go on for months in her past. She's been diagnosed with IBS. And then she also had long COVID in 2020 and 2021. So experienced vertigo, tachycardia, chronic fatigue, and some other long COVID symptoms. So like prior to the break, she would have said she was pretty healthy, like she's athletic, she's moving, but there is a lot of stuff in her history. And to be honest, this is kind of the case for most people. Like they might be thinking, oh, I have this totally clean bill of health, or everything's feeling fine. But when you really dig in, you go, there's some things that have been causing some threat for a little while, right? So first session with Jessica, almost immediately after the surgery, was just for pain relief. And in this picture, you can see after the surgery on her right wrist down there at the very bottom, they put her in a brace. They said, because we got the plate and the screws in there, they're going to hold it all in place while it's healing. We don't have to go back to a hard cast. So we're going to brace it. And I think it was at least an 8-week time period in the brace. And we'll talk about complications here in a second. But the first thing she said when we met, it was probably 4 or 5 days after surgery, if I remember correctly. She's like, it hurts. The pain is just excruciating. And so we first dove into this kind of pain relief process. So we went to opposing joints, which a lot of you are familiar with. That's just the concept that if you take the body and divide it, left arm goes with right leg, right arm goes with left leg. So working on the left ankle and the left knee, those are the opposing joint areas for her right wrist where the injury occurred. And there's a neurological connection between those. Okay, so if you haven't been through kind of our neuro programs and learned about that, they're connected with the spinal cord reflexes, with muscle activation pattern reflexes, and some neurological signaling between those limbs. So it's a great way to do pain relief, because when you start to work on one side of the body, the brain and spinal cord are going to talk to the other side and go, hey, everything's safe. So it's a great pain relief tool right there. Okay. We also did a bunch of sensory stimulus to the skin and tissues around the injury. So she had some pretty big gaps of sensory information that were just totally missing. We're not talking about on the incision site, because we had to stay away from that. Remember, this is only 4 or 5 days post-surgery. But all along the rest of her forearm, she had some numbness, especially down the inside of her forearm. And then when she could take off the brace, which was 1 or 2 times a day to clean the area, she could work on the sides of her wrist, especially on the radial side toward the thumb. Lots of numbness and weird sensations. So we immediately wanted to start working on sensory inputs to rebuild the map. Okay, so that was vibration, sharp, dull discrimination, temperature, like heat and cold inputs, and 2-point discrimination or 2-point differentiation. All right. So those are all just different types of sensory awareness that we really need to have a good level of precision and sensitivity to in our skin. And when we don't, when those things are missing, it's automatically going to create more threat in the system. So that was a kind of a big deal to get to start on that immediately post-op. The other thing we worked on was some magnesium glycinate, just calming her nervous system, and then some threat reduction. So we used color glasses and smell or olfactory activation in order to just do some general threat reduction for her, because those were some high payoff tools. Okay. So she goes into the second week, and unfortunately, she has a setback because she had an allergic reaction to the sutures. So warning, graphic pictures ahead. If you don't want to see gross recovery pictures, don't watch. Okay. But she had an allergic reaction to the sutures. They had to be forcefully removed from all the layers of tissue, and then the wound was resutured. So this is the photo of post-suture removal. Don't look if you don't like these things. This caused way more scar tissue to form, and a lot more sensory rehab and scar rehab was necessary after this, because it was gnarly. Okay. This is about 4 to 6 weeks after the sutures are removed, and you can tell she still has some scabbing and some healing that has to happen here. So it was not a fast recovery on the incision because of this allergic reaction. So what happened is it pushed back her rehab by a couple of weeks, maybe 2 to 3 weeks. We had expected to be able to get the brace off and start working on scar recovery in about 8 weeks. And turns out she got back in the studio dancing. She sent me this silly picture. She's like, first day back in the studio, 8 weeks after the injury. But then 9 weeks is when we picked up with our next session, right? So that may seem like a long gap, but she knew she was going to have about 8 weeks of physiotherapy to take place. And she's like, I'm going to follow the physiotherapy. I'm going to do my work. So she's like, you gave me the pain relief tools. I'm going to go to PT. We'll meet at 8 or 9 weeks because that's when we can start doing scar rehab. Now, when we met together at 9 weeks, that's when I found out about the allergic reaction. She's like, yeah, I still have some scabbing and some scarring. So we're not ready to do scar work yet. But we went ahead and had the session so that we could start working on some of the other things that were creating threat in her system. So if you remember her history from a few slides before, history of vestibular issues, and history of Crohn's and IBS. So the two things that those have in common are when you have a vestibular issue, you often have visceral and digestive issues as well. And when you have digestive issues, you also have vestibular issues. They're connected in a brain area called the insular cortex. And there's literally a vestibular association cortex and a visceral association cortex that go together. They talk to each other. So we wanted to work on her vestibular system as part of this rehab process. She fell for the original injury. She fell because she lost her balance. Clues you in that there might be a vestibular problem. And then to be able to connect the dots and get her overall threat level to decrease, we wanted to go to these higher order systems, not just focus directly on the site of injury. Okay, so in this session at about 9 weeks, we started off, first of all, doing general mobility. Because what she said is, it feels like my body's afraid to move. Like this is a big athletic dance flippy turn that she's doing when she falls. That's my version of a flippy turn. Woo! Okay, so she's doing this overhead thing and she falls, and that's when she crashes and breaks her wrist or her arm, but she didn't want to do any big movement. So I'm like, all we're going to do is just explore like big body movements. Reach out your arms as far as you can, like go into a wide stance. We're going to move sideways and twist and turn and go all different directions, like a big, starfish kind of thing. Just to get your body used to that. We're going to do vestibular drills specifically for your semicircular canals because rotations are most challenging for her. We're doing infinity walk, which is integrating vision and vestibular and proprioception all together. We're doing some visual training at this point. And then looking at her midline cerebellum. That is the area that's really integrating her vestibular inputs and ability to maintain balance while doing athletic movement. So we want to get all of those areas back online because at this point, remember, February 12th, she's back in the dance studio. So she's basically been sitting at home for 8 weeks, or maybe 10 from the time before the surgery, sitting at home for about 10 weeks, not dancing, not moving. So if she's going to go back and dance, and at the same time her wrist is still healing, I certainly don't want there to be another fall and another injury. So we have to include visual and vestibular training along with some integration stuff, not just look at the wrist, okay? She does continue doing rehab. That's at the bottom of the slide, right? So now we're into comparing the right and left wrist, going, hey, does this side feel like this side? Does this one feel like this one? And doing back and forth with all those different types of sensory stim. Vibration, sharp dull, light touch, crude touch, hot and cold temperatures, and 2-point differentiation. Okay, we did peripheral nerve mobility, so like nerve flossing or nerve mechanics. If you're familiar with those tools, we implemented some of those for the median and radial nerves so that we could kind of work around both sides of the wrist there on the thumb side. And then at this point, she had started doing some loaded mobility with the TheraBand. So I kind of just gave her some tweaks on those in order to not just work on her hinge movements of flexion extension and lateral and medial like deviations, but to do some circular stuff and some more complexity. So try to get in between the angles of the up and down and the left and right. Okay. All right. So that's at 9 weeks. Our third session happens at 11 weeks in March of 22. This is what the wrist incision site looked like at that point. So this is a photo from March. It's like we're ready for scar work. So we're going to do some kinesiotaping on the scar to start to develop a little bit of traction through the dermal and superficial fascial layers. There is no like protocol that you follow for this. Basically, you're trying to use the tape to reproduce manual traction or hands-on traction. So when scar tissue lays down, It's like a pile of hay just being thrown all on top of itself. All these little collagen fibers and skin fibers are laid down in a random assortment of directions. And so sometimes there become sticky points, or what we call barriers, in that tissue where the tissue has really poor mobility. And the reason this is such a big high payoff is because when most people, when they go to physiotherapy or PT, the primary focus is on restoring range of motion, not necessarily on restoring skin mobility or skin sensitivity. Those two things kind of get skipped over. They're like, oh yeah, it'll come back later. Well, lacking sensitivity to different sensations and lacking mobility in the skin, having it be sticky, both create major amounts of threat. And those don't necessarily show up as typical nociceptive threat that's going to create pain at the site. Instead, they show up more as like a sympathetic threat. So remember, most of your skin is innervated by your sympathetic nervous system. So when it can't get good information or can't communicate, it shows up as a sympathetic threat. And your pain may show up in a different area of the body or a different type of restriction, not just at the site of pain. So it's really, really important to do scar work. Okay. So we start on this, and then we also continue her sensory retraining. We're doing right and left comparisons, make this feel like that. And then all these different sensory inputs that we've already talked about. Okay. So this is the point where I'm like, keep doing your visual vestibular stuff, but we're really going to focus on getting back your full sensation and your full range of motion, right? So in March, this is March 12, I believe, 22. She's putting full weight back on the arm, and her wrist is doing really well with that extension under load. She continued doing the taping and rehab up until her 4.5-month check-in with the surgeon. So she goes to the doctor, 4.5 months. Doctor says, admitting nurse, first of all, didn't believe her that her surgery date was the first week of December. She actually said that's impossible that you could have had the surgery there. She had to go back and check the records. And then when Jessica meets the surgeon, he goes, look, the rate of the healing here, it usually takes people 6 to 9 months to get back 70% mobility. You're at 100% mobility after only 4.5 months. And he told her this. He goes, look, I'm about to retire. You are literally the last client I'm ever going to operate on. In my whole career, I've never seen healing that happened this fast. So he's comparing her to thousands of patients at that point. Never had seen anything like this. So really, really fast recovery. And essentially at that point, the surgeon goes, hey, you're done with rehab. You're great. So he graduates her. All right. So here's a note from Jessica, along with a photo. She goes, look, the screenshot may not look like much, but it represents one of the biggest wins that I've had recently. On this very dance floor, during a turn just like this, in a class just like this one, I broke my arm last November. You can see I still have some work to do. I'm tilting to the left instead of being totally straight and upright like the dancer behind me. But I have more strength and energy now than I ever have at the age of 46. And I was able to train and get back on the dance floor, not only to try it again, but to really enjoy it. I did many things to make this happen, but mostly it was my brain exercises. And I'm going to skip down a little bit. I didn't know I would be using the exercises I learned last year to heal my long COVID. And yet here we are now, right, rehabbing a wrist and getting back on the dance floor. So she, at this point, she was in the mentorship, like Kathy said. So she says, I'm becoming a practitioner to help others move better, feel better. And now I have these tools in my toolkit. So big shout out to us guys, saving my life over and over again. You're the best. So really sweet note, but I love the photo because it's like, this was taken August 22nd, I believe. August of 2022, less than a year after the injury, she's back to same movement, same turn, same action that had kind of taken her out. So this is her wrist now. This is October. She took this 2 days ago, October 7th, 2023. That scar rehab looks pretty good compared to where it was. And so she continues to dance. She's raised to the second highest level in her company. She still uses her neuro exercises every single day. In fact, here's what's really cool and important. Okay, if you're taking notes. In a recent Crohn's flare-up, she found that taping her wrist and working on sensory stim was one of the biggest threat reducers for her digestive system. Okay, so it's not just that because the scar here is going to continue to remodel for at least 2 years, probably a little longer. And she's almost coming up to that point. But it's so important to understand that this is a huge threat reduction area that she can go back to even when other stuff is cropping up. So congratulations, Jessica. And Kathy, let me turn it back over to you.
All right. So in proper case study kind of format, tell me what questions came to mind. What were you thinking as she started her rehab? The fact that her doctors were assuming 9 months, 8 to 9 months for a 70% recovery. Tell me, based on your work, you can tell me in the chat, you don't have to talk out loud, but what would you have wanted to know? What would you have done with her? Please, I would be happy to have you all share. This was such a powerful case study, not only for us, but as you saw, the doctor said, in my historical career as a surgeon, I've never seen healing like this. And there's a lot of people, I think, that would actually say, well, you were healthy before, you were an athlete, or you were this, or you were that. The reality is, yes, she had been dancing her whole life, but Jessica has fought through vestibular issues and visual issues her entire life. She's fought through Crohn's disease and with certain gut issues a lot of her life. She has overcome long COVID. She's done a lot in her life to create this level of health. So she wasn't this picture of perfect health when the injury happened. She had resources, she had tools, she had ideas, but she had to put her body through all the same paces that everyone does in order to heal. I think, to me, one of the most powerful things, well, let me say this. I worry usually when someone gets injured, most of the time our medical world goes, you have an X injury, don't move for X period of time. And yes, it takes energy for recovery, but what about the rest of the body that's sitting sedentary waiting while that injury heals? And so, yes, she was careful with her injury during that first 8 weeks. And yes, she had a severe allergic reaction, but it was right after that she got very proactive on full body rehabilitation. I had a colleague years back, and that colleague had major surgery as a child and also had a lot of gut health and vestibular and visceral issues all through his years growing up. Every single time that there was either a trauma or an injury or a flare-up of his gut health, one of the primary factors became the ability to look at the surgical scar area from when he was a child. And so, to me, Jessica's story and his story always go back to, we're a whole human. And sometimes we focus just a little too much on the area of pain, when in reality, our body, our brain, our nervous system is tracking all of it all the time. Our brain is never not tracking everything all the time. So you ask yourself, do you have a way to look at all the body all the time, to treat the body as integrated, not isolated? And I will tell you, in my family, in reality, in the last 10 days, my family has been through this personally, where a member of my family had to go to ER and was treated very acutely. And literally what they did isn't what saved her, in my opinion. What we did together to help her holistically, to look at her whole body in its recovery, I believe is what actually made the difference. Because our world looks at sometimes the single injury, forgetting to look at the whole. So I would encourage you all this coming week, as you go forward, looking at your people and your clients, if something comes up for them, either new or old, are you remembering to go back to their whole history? Do you have a way to prioritize what their brain considers the biggest threat that might need reduction in addition to wherever the current injury is? Can you look at them as a whole instead of their the summation of their parts, right? Or instead of just their parts. It's a powerful reminder. So that would be what I would encourage you to do this week. Hopefully you are enjoying this case study. We have another one coming up for you this coming Thursday. This coming Thursday, we're actually looking at more what happens when you have emotional trauma and what happens when you have more psychological trauma. How do you have the brain body, emotional, physical connection to heal through that? All right, so that's our case study this Thursday. I want to tell you one more date that's coming up. On November 15th is when the next mentorship starts for Next Level Neuro. Every single week after that mentorship starts on November 15th, we meet weekly to begin to create a protocol for how do you create this type of change for yourself and your clients. If that's something you're interested in knowing anything about, I would encourage you to send us an email at office@nextlevelneuro and just say, I'm curious, I want more information. I want to be able to have case studies like this. Let me just tell you this before you go. I believe that every modality around the world has a lot of power and a lot of validity. I think that almost every health system out there has power to heal humans. But I don't believe you heal people or that people heal as fast as if you can look at the whole body. I think that it takes not only the specialized approach, but I think it takes a general approach to heal people wholly and quickly. So if you would like more information, thank you, Andrew, for putting the email address in the chat. I appreciate it. If you want to know any more or you're curious, November 15th is when we start our next neuro group. And we would love to have you join us November 15th. And we will look forward to seeing you all now next Thursday. 3 days from now, this Thursday. I shouldn't say next Thursday, this Thursday. Talk to you soon. Take care.
Thanks, everybody. Bye-bye.